Good afternoon and welcome to all of you online, wherever you are, to the HL7 Europe webinar implementing HL7 FHIR in laboratory systems under the EHDS observations from Spain. You are in the right place if this is where you wanted to be. If not, then check your calendars or your meeting links. We're trying to get to start on time, and we already have quite a number of attendees here, so that's great. I'll go through some introductory elements before we welcome our featured speakers and then our esteemed panelists. So let me first say a few words about our Labs-on-FHIR webinars. The Labs-on-FHIR webinars have been a series of webinars that HL7 Europe has organized to discuss the implementation of HL7 FHIR in laboratory systems, particularly started by the publication of our implementation guide, the HL7 Europe implementation guide for laboratory reports that was published. It's already now a year or longer ago, so that's great. So we've been looking at different countries and how they operated, how they implemented FHIR in their laboratory systems even before there was an implementation guide. So there are previous editions of these. We've looked at Belgium, we've looked at Spain, at Netherlands. Alexander, you were the speaker there. We looked at Portugal and Germany and Sweden. So you can find all of these recordings on hl7.tv. Today, we're going to be looking at Spain, and we are proud to have as featured presenter Dr. Alexander Slotnick from the Directorate of Digital Health and Information Systems from the Spanish Ministry of Health. Alexander will be speaking with us for about 15 to 20 minutes, and then we will have a panel of experts and researchers and others. We will have introductory slides for each of those. We expect to start our panel at about 3:35 or so, maybe a little bit earlier, maybe a minute later. And then we hope to launch into a interactive Q&A with you who are the attendees of this, and we would be very interested in, and we want to encourage you to join this discussion. My name is Michael Strubin. I work for HL7 Europe. Just a couple of housekeeping items. All of the attendees here, with the exception of the speakers, you are automatically put on mute, but we do want you and we do want your input. So we encourage you to use the chat for comments and questions or any other input that you may have. Use the reactions or emojis during the presentations that you can also use. If you want to speak, raise your hand. Depending on how many raised hands we have, we may actually interrupt it or we may let you speak. And what we then need to do is we need to make you, we need to unmute you, allow you to turn on your video, and then you can ask your question. Ideally, you've already indicated your question in the chat so that some of us can react to that. And if you're invited to speak, please then turn on your video and say who you are. We're recording this webinar. If that's an issue for you, then please stay mute, but you're of course welcome to stay and to listen in. And the link to the recording and the slides in PDF will be shared with all of you and also those who registered but are not with us here today. With that, this is our agenda. We're turning a little bit around the order of appearances, but apart from that, everything here we proceed along the lines we just outlined. 20 minutes of presentation, and with that, I would now like to give the floor to Alexander Slotnick. Alexander, it's great to have you. Please take over, and the floor is yours.
Thank you so much for the presentation and also for the invitation from HL7 Europe to this event. My name is Alexander Zlotnik, and I'm the Vice Director of International Projects of Digital Health of Spain's Ministry of Health. We are going to make an overview of how digital services are implemented in Spain's public sector. And in particular, we are also going to see one new service that we are implementing at the cross-border level and also at the national level, which is laboratory results in FHIR. First of all, you may be somehow familiar with the structure of Spain's healthcare system in the sense that it is decentralized. The healthcare competences lie in the regional healthcare systems, of which there are 18 in Spain. We have 17 regions, and the autonomous cities of Ceuta and Melilla also have their own healthcare system. The Ministry of Health, which I represent, acts as a coordinator for our national healthcare system. We have a governance body which is able to reach legally binding agreements for all regions, and that includes technical specifications for interoperability in terms of digital health, in terms of technical, semantic, and also legal interoperability. This is the detailed legal pyramid that we have in Spain as a member state. The first layer is, of course, the EU legislation, the legislation of the European Union. And then we have national legislation and also regional legislation. And then the governance body that I mentioned in the previous slide is the Interterritorial Council of the National Health Service, Consejo Interterritorial de Salud, del Sistema Nacional de Salud in Spanish. Now I will briefly explain the implementation of My Healthy to You in Spain. What is My Healthy to You? Those are the digital health cross-border services that we currently have in production in the European Union. Those are pursuant to the Cross-Border Healthcare Directive, and those are voluntary in nature, in the sense that member states may opt to join these services or may not do so. The big change in the context of the European Health Data Space Regulation is that those services become mandatory, both at the cross-border and also at the national level. Our current situation is as follows in the EU patient summary service in Spain. 91% of Spain's population has an EU patient summary. Some of the regions, 2 regions in particular, are not yet able to share that information at the cross-border level, but most of the country is in production. And our aim is to get all the regions for interoperability in both the EU patient summary and prescription services in 1 year at most. Then it is also very important to explain that these services right now only cover Spain's public healthcare sector, but in the case of Spain, public healthcare is dominant. It represents more than 65% of healthcare activity in the country. In some regions, it's more. In some regions, it's slightly less. Then, in the case of the EU prescription dispensation service, we are quite advanced. Almost the whole country is now operational. Also, one thing I would like to mention is that in these cross-border services, we have interoperability with both Part A and Part B. What does that mean? In Part A, or Country A functionality, you can share data from your own country with other EU member states. And in Part B, which is much easier to implement, you only receive the data. Now, in all these services, with all the regions, we join with all the functionality. We join with both Country A and Country B. And by the way, Spain is the only large country in Europe which currently has an operational EU patient summary country A service. It's very challenging to do. You need to be able to get data from lots of data sources, and you need to be able to conform it and to also to send it on the fly in a limited period of time. We have real-time requirements because these services are used directly by healthcare professionals in the whole union. Then the last service that we're working on is the EU Laboratory Results Report. This is a new service and it is based on HL7 FHIR. The other services are based on CDA level 3 and also a PDF embedded in a CDA level 1 document. We are currently making a technical pilot between Spain's region of Catalonia and Greece, with both country A and country B. I also wanted to briefly explain how this all works also at the national level, because these implementations are nice at the regional and also at the cross-border level, but how do we make it work at the national level? So, first of all, you need a very good regional infrastructure and also national interoperability systems, which allows you to interconnect the regions. Even in countries which are more centralized than Spain, in the end, you are going to end up with a regional approach, because for different reasons, there is usually some kind of consolidation of information at the regional level. Then you need to make sure that those regions or those large entities which you interoperate with are compliant with all the requirements, the technical, semantic, organizational, and also legal requirements. Now, what we do in Spain, in the particular case of the cross-border services, is that we make sure that all the regions are compliant with all the EU-level requirements. So the European Commission audits Spain's Ministry of Health as Spain's central cross-border interoperability node. But then we, the team of Spain's Ministry of Health, audit the regions with exactly the same requirements. This is a rather challenging audit. We have more than 2,500 pages of specifications, and many of them have to do with cybersecurity. If our region joins one of these services, and by the way, they do it with all their points of care, that is, all the pharmacies, all the hospitals, and all the primary care centers, when we join with all the points of care. This region needs to pass an audit, and we make sure that the regional entity is compliant with the aforementioned requirements, many of which have to deal with cybersecurity and personal data protection. Now, let's go to the lab results in FHIR implementation strategy. What have we done so far? Well, we are currently at stage 1, at phase 1. What we have done so far is to perform a technical and semantic connection test with Greece from Spain's Ministry of Health. Our national and regional infrastructure still has work to do in order to be compliant with the laboratory results document, but we are getting there. In phase 2, we are going to add Spain's region of Catalonia to the national interoperability infrastructure for this service. We have an enterprise service bus approach where the regions connect to Spain's Ministry of Health in order to exchange health data between them and also exchange clinical data with other member states in the cross-border services. We're also working with a national guideline for FHIR lab results, because we have an EU guideline, but we see that it needs some adaptations for our national and regional scenarios. Then we'll also release a display tool for our regions, including Catalonia, and then we will go live. That is, we will go into production with this service. We will be able to exchange live data with the countries which also join this service in production. Right now, we have just Greece, but it is our hope that in the June testing event, which is a second pre-production event for testing these kinds of services at the EU level, we will be able to add more countries. Now, in the particular aspect of the implementation guide and Spanish adaptation, we would like to mention some things which we believe are quite relevant. First of all, we are building upon the My Health ETU specifications, which come from HL7 Europe, the most part. Then we are going to introduce adaptations upon that incrementally. If a particular resource has not been tailored to Spain's requirements, the MyHealth-FHIR definitions will apply by default. That is, by default, we are going to use the MyHealth-FHIR HL7 FHIR specification, the guideline. And then we sometimes need to make certain adaptations with null flavors. That is, when we have some coding issues, we need to send data directly, and we display text just in English in order to overcome some of the semantic challenges that we see with this guideline. Regarding the technical implementation, this is a high-level architecture that we have in Spain and also in the Union. So in the regions, we have regional healthcare interoperability infrastructures, which are fully connected. They connect all their points of care. Then from the Ministry of Health, we provide a secure data network, which has a very high level of security in order to interconnect these regional health systems. What do I mean by that? We set a secure router in their facilities, and then we connect it to our private network. Then we also make sure that the connection works not only on the technical level, but also from the point of view of end-to-end encryption. And we also make sure that the services which are connected to Spain's Ministry of Health, which serves as the regional and national interoperability node, is also compliant with the functional and semantic specifications. Once we have this infrastructure in place, that is, our national interoperability is solved, we can also exchange data at the union level. What we do in the EU countries right now is that we set a technical node, which is an instance of the open source OpenNCP software, and we connect it to all other OpenNCPs of other EU member states. So we have a meshed network when we do cross-border health data exchanges. That is, we have no central point of failure when we use the cross-border services. And at the network level, that is done through the secure S-Tester network provided by the Commission for Public Services, provided at the cross-border level by the EU member states. What are the key issues in lab results implementations that we have seen so far? Well, firstly, the semantic guidelines sometimes conflict with our national requirements. We have many different semantic requirements in the member states, and those are very, very important for us because that is how our healthcare professionals register clinical data. And this sometimes clashes with the guidelines that we have right now, at least for the laboratory results service. And this is going to be a very significant challenge to solve when this guideline is more widely adopted and implemented. Then the usage of FHIR resources is sometimes challenging when we work in multidisciplinary teams. That is, sometimes it is challenging to convey the concepts of inheritance, for instance, between data objects for persons who are, well, clinicians, for instance. But it is a must. We must include clinical persons in our teams because they're going to be the actual users of the system. Sometimes technical people come up with very original ideas, but which actually fail when we put them in practice in the clinical world, which is why multidisciplinarity is very, very important. It's fundamental. It's a key success factor for any kind of these specifications to work. Then, of course, there is a high variability in lab reports. And that is a challenge not just for Spain, but at the world level, I would say. So there are many specific challenges which we are going to face in production or in pre-production when we actually put this service to work. And this is why, by the way, we wanted to join early, to be early adopters of the specification, because theoretical discussions, they do not add that much value, because in the end, you need to face reality at some point. This is why we wanted to join this service early, to gain experience and also to be able to provide feedback to the standardization organizations and also to the lines of work which currently exist at the EU level in order to establish the technical requirements for this service and also other services which will become mandatory pursuant to the European Health Data Space Regulation. Then there are some technical constraints. In our case, in the Ministry of Health, we use an Oracle service bus, and we have several dependencies upon that integration solution. And it is sometimes challenging to make it function in a way which is fully compliant with FHIR-based APIs, which are, of course, needed for FHIR-based services. Then we will need some time in terms of regional adoption because Spain's regions have a different level of resources devoted to digital health. And in some cases, they are more advanced, and in some cases, they are less advanced. So we will have a scaled approach where some regions join first and other regions join a little bit later. This is exactly the same approach that we have been doing with other national and cross-border services. Thank you so much for your attention.
Thank you, Alexander. This is perfect, and you are a model presenter. You stuck to the time that we gave you, and I think you went through your slides in a really efficient way. This is fabulous, and we see a couple of, at least I saw one applause emoji. A word to our attendees here. Yes, thank you very much. I think this is great. But of course, we don't just want you to listen. We also want you to ask your questions and make any observations. But help is on the way. I am now going to take back control here. Alexander will be with us for a little while longer. So you can also, of course, ask your questions and add your comments in the chat. But we now have a panel of esteemed experts, researchers, and what do you want to call it, to give their and share their own observations. And so I'm really glad to welcome here Alexander Henket from Niktos, Nikos Kyriakalakos from, sorry what I just did to your name, Nikos, from HL7 Hellas, and Catherine Groner-Key. In turn, they're going to offer feedback, maybe share their own questions. And I have a question too, but if you give me better questions in the chat here, then of course you can add your questions in the discussion and Q&A, which will follow after the panel. But let's now first go to the panel. Alexander, I'm going to just go to your slide, and Alexander, floor is yours.
Thank you, Dr. Slotnick, for a very interesting and elaborate presentation. I must say you have impressive results in Spain. My name is Alexander Henket. I work for Niktos, as it says on the screen. I'm an interoperability specialist from Niktos in the Netherlands. In the Netherlands, we have a similar situation as what I think I see in Spain, which is a very decentralized way of doing communication, and we actually have several networks going on that connect all the different sources that data could come from. In your case, I see 17 to 18 regions that data can come from, each having their own specification in doing so, it would seem. And they all connect through an enterprise service bus that in turn connects to the NCP into Europe. So it would seem that you have many specifications, versions, terminology issues to solve. How do you organize all the specifications and the progress of specifications to make sure that you offer people coming through your NCP and ask you for a patient summary or a laboratory result that they actually get what you would expect based on the European specifications?
Thank you for the question, Alexander. Well, first of all, you need a very good semantic strategy at the national level. Like I said, in Spain, these services actually connect the public sector entities, which is still most of our healthcare system, most of our healthcare provision, and we have data for 91% of our citizens. But of course, you need a very good national standardized semantic strategy, and you need to be able to somehow enforce it. In the case of Spain, there are several terminologies which are used at the national level. And then, like you said, we have this decentralized approach, and in a way, we are like a mini European Union. In order to make this work, you need to listen to the stakeholders and to have solid cooperation for. And well, here we try to make a very good effort to keep our technical and semantic specification correctly updated, and also to have it in the law. In the case of Spain, all the clinical reports which are exchanged through the ministry's interoperability nodes are available in this law, which I've just pasted in the chat. It specifies the format and the fields and the terminologies which have to be used in the reports which are exchanged at the national level, and also at the national level between regions. Then regions have the freedom to use that specifications at the regional level or to use another one. But in the end, there are probably 3 lines of standardization. Regions often have their own regional needs and they produce their own specification. Then they have to adapt this to the interregional specification, which I've just pasted in the chat. And then they also need to adapt to a third format, which is a European one. There is no real shortcut to that because, for instance, at the cross-border level, we have slightly different semantics in many ways. We have a semantic server which is used in all the open NCPs of the Union. And it uses, for instance, just a single version of certain terminologies, and it uses subsets of certain terminologies. And at the national level, we use a much wider semantic approach. So in the end, you have to transform that data somewhere. In the case of Spain, we provide the semantic resources, and we also provide training, assistance, help, and we have a very good SNOMED CT National Reference Center. And the entity responsible for making those transformations, in the case of the patient summary, is the region. And in the case of a prescription dispensation, we perform some semantic transformations directly at the central level in the Ministry of Health. This is due to different approaches to legal responsibilities, legal liabilities, and also in the way that clinical documentation works in both of those cases, because it's quite different in patient summary and in a prescription dispensation.
Thank you very much. I have one follow-up question, if Michael will allow me, time-wise.
I will.
So currently you have lots of mapping to do from versions anywhere. Is there any tendency towards having the things that are now very disparate to harmonize a little bit more? And do you see regions looking at European specs, for example, to update their specs with to be more compatible from the beginning? That would be lovely.
I wouldn't say that we map so much. We map certain things mainly in the prescription dispensation case, and then in some very specific cases we have certain mappings at the regional level and patient summary, but that's not very common. The reason for that is quite simple. When you map clinical terminologies, it's very dangerous when you are working with documents like the patient summary. If you are mapping from a less specific to a more ample terminology, you are likely to add clinical information which was not there. If you have the reverse case, that is, you map from a more ample terminology to a smaller one, you are removing clinical content, which is why in many cases we send the data in English with the original code in the case of the EU patient summary implementation, because we believe that it is most fundamental to make sure that the original clinical data is transferred in the with its original meaning. I don't know if that answers your question. Then, regarding semantic standardization, well, the terminologies that we use in Spain are already, for the most part, mostly international. So I wouldn't say that there is a need for an overhaul of that. In fact, I think that it would be very, very damaging to do that, because we have lots of historical information in those terminologies. And we are rather following the opposite strategy. We need what we already have. We have a lot of historical information already coded in internationally recognized terminologies. We want that recognized at the EU level. However, that doesn't mean that we cannot adapt certain ideas, certain value sets, perhaps some specific value sets, which are associated with certain FHIR resources, for instance. But in general, and most importantly for the strictly clinical information, we would, for us, it's really, really important to preserve our original terminologies, our original coding systems, and our original clinical content.
Thank you very much.
Thank you, Alexander, and both Alexanders, as a matter of fact. And I think I was very glad to give you the extra minutes. We also already have quite a few questions in the chat, so please feel free to also review them, or some of those if you have answers to some of those questions. But I'd like to now go over to Nikos, and I'm going to give another try to pronounce your last name, Kyriakoulakos. Maybe this one. And Nikos, you of course come from HL7 Hellas in Greece, so you may have different issues but also similar issues to tackle. Please go ahead.
Yes, thank you, Michael. First of all, thank you for the invitation. As you told us, my name is Nikos Kyriakoulakos. Your pronunciation is correct. I'm Secretary of General HL7, Secretary General of HL7 Hellas. I count myself as a health worker, interoperability worker. So at the last 20 years plus, on behalf of my company as a principal architect, and also from HL7 Hellas as a volunteer from the beginning, and also from time to time as a WHA consultant on digital health interoperability. Now, the last year, I work with other colleagues here in Greece in order to set up the FHIR core working group in Greece. So it is very important for us to have also to get the experience from tries like this one from Spain. Now, first of all, congratulations to Alexander for the clear presentation today, and of course for the structure progress that Spain is making. A couple of points, especially from the Greek viewpoint. First, your phased implementation strategy for the laboratory result report is very interesting for us, especially phase one that involves the direct connection between Spain's Ministry of Health and Greece is obviously of great interest for us. Okay. For us, understanding the practical step and possible challenges for the cross-border FHIR lab result report service will be important for both of countries. Second, the challenge of interoperability across 18, I think, regional healthcare system, while the ministry focus on coordination policy is a common experience, I think, for many countries. And of course, in Greece, while we don't have so independent regional healthcare systems, But that's where your experience will be also valuable for us. Now, reflecting on Greece's current situation, as far as I know, our national e-health authority, DICA, which serves as our national contact point for health and is driving the digital health reform now, is actively participating in My Health EU services. So, and also at the standard level, HL7 Hellas that somehow I represent here now, recently initiated the official HL7 FHIR work group, as I told you. And our primary goal there is to create the Greek National FHIR Core Implementation Guide or guides. Among the first cases that we are looking is, of course, the laboratory report. And of course, we are planning to use the HL7 Europe lab report implementation guide as our foundation. Now, for the questions, I have a couple of them, if I may. I will start with one that moreover you answered in your presentation, but it's good to hear from you a comment. So in your presentation mentioned that laboratory results report differ between regions in Spain. When a request comes from My Health EU, what level of data harmonization or transformation is performed at the national NCP level before the data is forwarded? And how does Spain ensure that a consistent report is sent externally, given that internally you have variation, as you told us?
Well, the approach that is likely to be followed in the laboratory results report is similar to all the other reports that we share at the national level. It just so happens that we also share it with with other EU member states. In all those cases, the data source and the entity responsible for data coherence is the regional healthcare service. Now, we have three environments, two of them for testing and one of them for production. There we perform integration and conformance testing between the region and the Ministry of Health, and we also perform functional testing. That is, we have physicians from both the Spain's Ministry of Health and also the region in order to also make sure that the functional requirements are met and the report makes clinical sense. This is the strategy applied to every single report which is exchanged through Spain's national digital healthcare records exchange system, which allows for the exchange of reports between the regions. And we also have citizen access, by the way. We have a national digital service portal, not just for health, but for all other digital services in the country, from which you can access as a citizen your own healthcare records in all the regions. Now, how do we make sure that the open NCP sends the right data? Well, it's simple. The region is responsible for making sure that the report has the right specification, both in terms of technical interoperability, structure conformance, and also semantics. In order to ensure that, we audit that region and we do lots of production testing at the national and also at the cross-border level. So this means that the Open NCP, which is at Spain's Ministry of Health, mostly acts as a relay. It may be the case that in this particular service, we find a situation where we need to transform something at the national level, but that's not the preferred approach for clinical reports, like I said in an answer to a previous question.
Okay, thank you. Thank you very much.
The reasons for that is that the regions are autonomous, but they're also responsible for their own clinical content. And this is why we also do it in this manner.
Okay. Thank you. It's clear for me, at least.
Thank you, Nico. Yeah,
I have one more question. May I?
Okay. Although you're battling. Okay, go ahead.
Okay, thank you. Now, the Spanish FHIR laboratory result report implementation guide adapt, of course, the My Health EU specification to national requirements. For example, you say the Spanish surname format. what is the national governance process for determining these adoptions? It's very crucial for us because we are in the beginning, so governance is very critical thing for us.
Well, like I said in one of the first slides of the presentation, even though Spain is a decentralized country, we, in the field of healthcare cooperation, we have a governance body, which is called the Spain's National Health System Interterritorial Council. There, all our regions are represented, and it has a subgroup which deals with digital health. And there, we reach these kinds of agreements with the regions. Now, one thing I would like to underline here is that I believe that this requires many years of work in order to function, because even if you have some legal instruments in place, in the end, it's about trust. It's about your reputation, I would say, as an organization, because you need to make sure that whatever stakeholders you cooperate with, they can trust you. And that trust, that authority, because those stakeholders give you the authority in the end, because otherwise the system would not function. That is gained through many, many years of work, many years of listening, many years of meeting expectations, sometimes failing to meet those expectations in some cases, recognizing your mistakes, changing direction, and adapting to a switching environment. But once again, there is no easy solution. The minimum thing that you need is some kind of governance body at the national level, but then it's about a multi-year investment, which has to be consistent in time.
Thank you. Thank you very much.
Thank you, Nikos. Thank you, Alexander. Trust is a journey, isn't it? And Spain probably sometimes feels like a mini Europe, like other countries in Europe. Catherine, over to you. And I think we have a slide for you as well. Catherine, introduce yourself and raise your points or questions. And unmute yourself, please.
Hi. Good to hear what's going on in Spain. We are indeed working with several of the regions in Spain, including Catalonia, and we are always surprised at how the Ministry of Health in Spain is making sure that it is abreast all of these developments. Indeed, Spain is a very large country in many ways. What we have been doing in HL7 is making some of this trust flow. And in that sense, our mission, and maybe you can show the next slide to guide my question, is to make sure that people have access to their data. And in that sense, we are saying that EHDS gave us this mandate. Let's try to do that with HL7 FHIR the best way we can. And if there are some differences in the implementation guides, let's see how we can mitigate those. Do you feel that this strategy is a good one?
I'm not sure that I understand the question.
The question is to make sure that we have the individual, the citizens, being able to access their data in a computable format. In a way that you have the specification. It may not be mature, it may be at different levels of maturations, but in the end, you have the computable data there.
Well, of course, like I said, I think it's very important to test these things, and if we can have something which is closer to a production environment, even if it's not perfect, it's never going to be perfect, that's a good approach. My understanding is that the cross-share approach is that of the yellow button, which is surprisingly similar to the blue button used in the United States. And it is, well, a simple solution where you can get some data at the patient side, that patient manually uploads that data to a different healthcare provider. So, well, that's quite simple from the point of view of personal data protection, because there is a clear action from the user. The user can have a nice box to consent to certain things. But well, in my opinion, this approach is a little bit limited, because in the end it implies manual actions from the natural persons. It's not a bad approach, but in many scenarios you probably would prefer not to do that, not to put the burden of that manual action on that physical person. It would be much nicer to have all the entities connected to an interoperability infrastructure with all the necessary cybersecurity and data controls in place, but to avoid this manual action, because otherwise we have this rather manual interoperability approach. That being said, we always support these kinds of initiatives from Spain's Ministry of Health, because in the end we need to test these the different use cases, and there are always many interesting lessons learned. So, well, we are fully supportive of this line of work. We are participating as observers. We are not very active in these lines of work, but we try to make sure that there is a person from Spain's Ministry of Health in every single line of work at the EU level, which is involved in the standardization efforts in the primary and secondary use of health data pursuant to the European Health Data Space Regulation.
Yes, indeed, and I take the point that it is a very simple approach, and indeed, one of the things that we try in Spain is to connect with a simple approach the public and the private sector, in particular in Catalonia. But I do have another question with you. One of the great things that we always comment OpenEHR is the fact that it has a very detailed business analysis of data, very, very detailed information. I remember also some colleagues in HL7, like Stan Huff, who were doing a lot of work to detail all the lab information. Do you see some of this work finding its way into your plans in Spain?
Well, first to react to your first comment, the blue or yellow button approach, like you said, it's only used in Catalonia. The reason for that being is that compared to other Spain's regions, Catalonia has a much larger private healthcare sector, and so, well, there is this regional approach to make data sharing a little bit easier between the private and the public sector. We see it as a good approach because it's functional, it works, but it should be considered an intermediary solution. We should be more ambitious in that regard. Regarding your second question, in OpenEHR, we see a very, very powerful approach to clinical data modeling, because here there is a very good clinical view of what kind of data and how it should be exchanged. And once again, in the region of Catalonia, we have also a very ambitious approach to build a very strong interoperability layer between the different EHR systems which they have at the regional level. So in a way, the idea is to make it a little bit vendor independent. And that is a very, very, very ambitious approach, very interesting, and it would solve many of the interoperability challenges that we have right now. However, due to the ambition of this approach, it also requires resources, and it also requires persons trained in OpenEHR. But we think it's a very, very interesting approach. We are following it very closely with our colleagues from the region of Catalonia, and well, we believe it's a very, very powerful tool from the point of view of clinical data modeling.
Mm-hmm. Thank you very much. We indeed do have the approach of testing. even if it is a step by step testing with the button. We will follow with APIs, of course, but we try to take one step at a time, and we appreciate very much the work and the support that we receive from the Spanish Ministry of Health. In fact, we are also working with another region, the region of Valencia, two regions in Spain and the central government. So it's a great honor and a privilege to work with you. Back to you, Michael.
Thank you very much. And of course, we haven't even mentioned the big HL7 HL7 meeting that's happening next week. So there's another slide for that. So with that, I'd like to now open this up for a general Q&A. There has been quite some discussions in the chat here, both asking some rather technical, some political questions. I saw that I invited our attendees to rank their questions, and I'd like to invite Mariam Shukrallah, who's joining us, to pose her questions, because she got the most thumbs up, but I'm not sure whether she's still here. So in the absence perhaps of her, Declan Kieran, maybe I'll ask you to maybe make your point here and become involved in this. Would anybody like to raise their hand who would maybe perhaps indeed join this meeting, because that would make it probably easier for me to react to you. Otherwise, it feels like I'm picking you out without perhaps you really intending to. Fergal is the one, and I'm going to see now whether I can quickly unmute you. And I think I can, so I'm going to make you presenter. Please tell us who you are and raise and indicate your question. Fergal? You should be able to unmute yourself and to open your camera. Are you? This always happens, huh? Let me see whether I can.
Yeah. Okay. You can
Here we
hear
go.
me? Yes. Yeah. Good.
Yes,
good.
we can.
Yeah. No, I'm involved. My name is Fergal Bell. I'm involved in the e-prescribing project in Ireland. We kind of in its infancy, we're trying to develop an app and also a database that would link in with the National Medicinal Product Catalogue, so that we can create this app for patients and members of the public to be able to go into and look at their medication, look at their prescriptions, repeats, and so on. I just wondered, is there any? I know there's some sort of connection between Ireland and FHIR, but do you know how advanced it is, or any updates on that?
Yes, well, firstly, when we are talking about country level interoperability, that's usually the competence of the National Health Authority. That is in some countries that's constitutional law. In other countries, it's slightly different. But in the end, you need to involve the ministries of health of the different countries. I'm not aware that we are currently even in the planning phase of testing something FHIR based with Ireland between countries.
Okay.
But as you've seen, the adoption is it's going to take some time. We are just testing between Spain and Greece, and we have 27 member states. That being said, if you know someone from the Irish Ministry of Health, we would be delighted to also include them in the next testing round for lab results. That would be very welcome, because we need also other testing peers in order to make sure that our implementation is robust.
Okay, so there's no HL7 FHIR pilot projects between Ireland and Spain at the moment.
As a country with country, no, but of course that does not preclude Spanish vendors or Irish vendors or even research institutions or private hospitals, for instance, which are present in both Spain and Ireland, to have some kind of FHIR implementation or some FHIR.
Yeah, well, just the reason why I get to that, because we're in procurement stage, so I know that we use the Irish edition of SNOMED is used. not entirely used, but certainly we have someone looking after that through the Irish Health Service. But I know that SNOMED FHIR was part of and parcel of the actual implementation, hopefully in the next couple of years, of a patient app.
Thank you, Fergal. And with a look already at the clock, and I'm already getting error messages or warning messages that only 5 minutes are left. There is one more hand for Catherine. Catherine, I'd like to give you the floor, but perhaps you can already combine this because we know that Alexander has a hard stop at 4. Over to you, Catherine.
Let me respond to you, Ferg, with this open call we are having, and Fergal.
Yes.
This is like a paid question to me. I don't know. For everyone on the call, we didn't agree. There is no previous agreement with Fergal Bell here. Giorgio Cangioli is also leading a team. Actually, it's not that person. It's Ruth Lindstrom under the leadership of Giorgio Cangioli, who is the technical lead for HL7 Europe. They are working on the e-prescription in dispensation, and this is again aligned through Europe and also as part of the EHDS specifications and My Health at EU. So you can reach out to either of them, Giorgio or Ruth, and get more information. In XR, one of our partners is in Ireland, the Irish government and HSE.
Okay.
And we do have this open call for interest for early adopters. And there will be also some small grant money for the winners. And the idea here is to implement the XR button and be able to consume and download and upload data on HL7 FHIR, and also use a smart health link to read a prescription or a dispensation or a lab result or a lab report. Yeah, so have a look, Google us, and you will find it, and we will be ready to engage you on those. Thanks.
Okay, thank you.
And I see that Alexander also raised his hand. So, of course, Alexander, please go ahead, unmute yourself.
Yeah, thank you so much. I would like to use the last minutes, if that's okay with everyone, to address the remaining questions in the chat. Kevin, do you have any links to your national implementation guides? Well, the public link is already in the chat, and the technical and semantic specifications for interregional interoperability are only shared with our regional stakeholders, with our regional actors. Then, Dan Parker, related to Kevin's questions, do you have any links to your national implementation guides? Same answer. Are there, Fergal Bell, question about projects of interoperability between Ireland and Spain for FHIR, that has been already answered. Then we have a question from Mariam Shokralla, a big challenge regarding the conflict between national and EU-wide semantics. Well, short answer, I would say that semantics should be mostly a national decision. It's not realistic to standardize certain things at the EU level. However, certain subsets, certain commonly agreed value sets could be defined, but that depends on the use case, and we should very, very carefully consider how exactly that works at the cross-border level. But at the national level, we really shouldn't, we should provide some kind of flexible solution for that, because we are not going to change in a very significant manner the way in which our healthcare professionals register data. That is a national competence because it has to do with how our national healthcare systems are governed. That is a national competence in EU law. That being said, of course, we need to define some kind of semantic interoperability at the European level. One approach is the one used in the OpenNCP. That is a semantic server which uses certain subsets of terminologies which allow for this kind of clinical data sharing with these subsets. Also, with current AI technologies, we can provide really, really good machine translations of clinical reports. clinical reports, we usually have free text, and we should really consider the possibility of using that free text. Semantics is nice, it has its use case, it is extremely useful, it's fundamental in some use cases, but in other use cases, we should really consider the possibility of free text and really, really good machine translation, which we already have right now. Then there are several questions. There is a rather long discussion about the standardization of units, reference ranges, sensitivity levels among all laboratories. That's quite challenging. There is no easy answer to that. And well, what we can provide realistically in a report is some kind of confidence interval for certain clinical measurements related to lab results. That's of course far from perfect, because the tolerance levels and the ways in which these confidence intervals of the measurements vary widely between machines, between different laboratory testing facilities. Another challenge, by the way, is how we group those results. What is a basic clinical analysis? That depends, that varies on the facility, right? What is a basic blood test? That depends very strongly on the testing facility, on the hospital. So indeed, there should be at least some kind of metadata to at least identify the basic kinds of analytics of laboratory result groups that we can define. Then perhaps a minimum data element, but that's going to be a very significant challenge. We'll try to do that in our national guidelines, but there are many things there which are open questions. Then Kevin asked about national standards for HL7 version 4 laboratory results. We do not have those. However, one region, which is Spain's region of Castilla y León, has an excellent guideline for HL7 version 2 for lots of things. It's a little bit old, but it has been adopted by several regions and even by some healthcare providers in the public sector, in the private sector, sorry. So it's very long, almost 1,000 pages, but it's quite useful. It's not a national standard at all, but it could serve as a reference if you are planning on doing something in Spain with HL7 version 2X. Thank you so much for your attention. I believe that we need to close the meeting. And thank you everyone for attending this event, the panelists, and also all the persons who came. It's been a wonderful opportunity to present our work. And also big thanks to HL7 Europe for making all of this possible. Thank you so much.
Thank you very much. And I see Catherine also wanting to say something. And you unmute, Catherine.
Yes, I would like to thank Alexander from HL7 Europe perspective. We learned a lot about Spain, and I think we understood a little bit more some of the challenges ahead. So we are very much grateful and looking forward to visiting Madrid later this week already. Yeah, and the working group meeting next week.
Of course.
Warm thank you to all of you who joined, and the webinar recording and slides will be up very shortly. Thank you so much and have a great rest of the day. Bye-bye.
Bye. Thank you so much.
And with that, all of